I went to the very first course that Jason ever offered on biofunction, and it was good, and there was a lot of information, and I took a lot of that and went back to my practice and incorporated looking at the biofunction, looking at the occlusion, instituting the T-scan with my patients where I was seeing a disease or an attrition degenerative process. We've had a number of patients where we've looked in their mouths and seen what is very obviously some sort of an acidity issue, and sat and talked with the patient a bit. And for some of them, they were like, I'm not so sure about this. And we gave them a very simple alkalizing protocol to start using that Jason had recommended and given us in the course. And some of them, in 6 months, they'll come back going, doc, that was like one of the best things that I ever did. It's just really calmed down a lot of the issues I've been having with indigestion. And there were some other things going on that I wasn't even aware of, that once that was calmed down, I could kind of see what else was going on with my health and could get those things addressed. Overall, it's allowed me to start having conversations with my patients that aren't, hey, open your mouth and let me see what work I can do for you. Much more of I'm seeing this going on. How's your overall health? Are you experiencing these kinds of issues or these kinds of problems? And now they're starting to read me as, you care about me more than just what work you're going to do next time. For my patients that have been a patient's record for a long time, and then all of a sudden I'm sitting down with them and starting to have this conversation, and they're saying, well, why didn't you notice this before? And what I told them was the truth. I said, I was seeing some things that I couldn't account for with the training that I had done so far. And when I started looking at the materials and the presentation about what this course was about, it seemed like the problems that my patients had that I couldn't account for. And so I went to the course, I got trained, and all of a sudden, I understand what I was missing. And so that's why I'm now talking to you about this, even though you've been my patient for 20 years. Now is when I understand what's going on for you, and we can help you out by doing these things. And they seem to be very open about that, very open to that. And they're also very impressed that a doctor's been doing dentistry for 20 plus years, 20 years with them, and longer than that just in practice, is willing to go back and get trained so that he can better serve his patients. So there's no barrier there whatsoever. That it's a smooth transition. It's an easy conversation to have with patients. And it's, I'm being completely honest with them, because that is exactly why I came here the first time, and it is exactly how this fits into my practice. So yeah, if you've been once, might not be a bad idea to come back a second time. There are a number of things that I picked up the second time through that I think I'm going to be incorporating and tweaking a little bit. And if you've been wondering, well, should I come in and see this? Is it directly applicable? Is this just going to be a bunch of stuff I do that I'm not going to get paid for? The answer is no. You're going to take better care of your patients. You are going to get paid for it. It pays for itself easily within the first 6 months. And it's certainly going to elevate your practice to a different level, both for yourself, your staff, your patients, and kind of where you are in your community. So I would, if anybody's asking me, I'd say come out and take the course, and it's worth it. It's well worth it in every way.